I teach biology here at GTCC. I've been here for 15 years. I mainly teach anatomy and physiology. So I'm going to be in the nursing program, in my class, or one of our classes. The first thing I'd like to open by showing some myths about dementia and Alzheimer's disease. Things that people commonly think, associate with dementia and Alzheimer's disease. And the first one is dementia is only caused by Alzheimer's disease. True or false? False. There's lots of different reasons for dementia. Dementia is always irreversible and progressive. In other words, you never can go back, and it always keeps getting worse. That's not true, actually. We'll talk about some reasons why. Dementia only occurs in older people. For the most part, that is true, but there are some cases of younger people, even children with dementia. There is a definitive test for Alzheimer's. If you suspect your relative of having Alzheimer's disease, there's a test you can go to, and they can actually definitively tell you whether the person has Alzheimer's. True or false? False. There are lots of tests that point to Alzheimer's, but in terms of actually a blood test, a medical test, there's really no definitive test. Most Alzheimer's disease runs in families. That's actually false, because there are different types, but it does not always run in families. So it's not always very predictable. An Alzheimer's disease vaccine is being developed. That's actually true. And that's good news, right? For us, or all of us that are, all of us, actually. Of course, all of us are getting older every day. And then Alzheimer's disease has been linked to pollution and other environmental agents. Have they ever discovered an environmental agent, a pollutant, that causes Alzheimer's? The answer is no. There were, several years ago, it was thought that perhaps aluminum, people drinking out of aluminum cans, people using aluminum cookware, but that has been disproved. So all of these, some of them are true and some of them are false. So let's look at brain anatomy. Brain anatomy. And I just happen to have a brain with me, another brain with me, plastic model. Human brain contains up to 100 billion neurons, or cells, nerve cells. And the cerebral cortex covers the cerebrum. There's 3 areas of the brain. All you guys are in psychology? Are you in psychology? Is that why you're here? Nursing. Nursing, okay, cool. Well, then you already know this. The brain is made up of 3 major areas. This part is called the cerebrum, the largest part that covers all the others. This part here is called the cerebellum, that controls our movements, graceful movements, sends messages to the brain about our muscles and our joints and our position in space. And then this part is the brain stem, and that controls the functions we don't think about, our respiratory rate, our heart rate, our blood vessel diameter, things we don't think about. So this is the model of the brain. But the cerebrum, this big part of the brain, is covered by a layer it's a fraction of an inch thick called the cerebral cortex. And it's highly folded. You can see from this picture, it's very highly folded. If you were to take the cerebral cortex off of the brain and spread it out, get rid of these folds, spread it out, it would be the size of a standard pillowcase. It's pretty amazing that a much area can be put into a fairly small area. And that part, the cerebral cortex, a highly folded part, is responsible for memory, learning, speech, personality, reading, higher order functions, human functions that we associate with being alive. Beneath the cerebrum is a subcortical area. So you nurses probably know sub means underneath. Of course, underneath the cortex is mainly white matter, and it helps to connect this part, the gray matter, the cerebral cortex, with other parts of the nervous system. This is important to remember. Some brain areas can produce new neurons, some, but most neurons must serve the person from birth till death. You don't get any more, typically, which is the reason why brain injuries are forever, unfortunately. The long lives of neurons makes them subject to damage as we age. So you're born with most of the neurons that you're ever going to have, and they're kind of resorted and so forth, and when you become an adult, and then they remain there. So they're really subject to a lot of damage. Symptoms of dementia are dependent on what area of the brain experiences the loss of neurons. Once the cells die, it depends on what area of the cerebrum you're talking about. So when you look at this picture, then you can see that the cerebral cortex, which they have in different colors, is responsible for different things like speech, reading, visual association, your occipital lobe, where you associate words with images. And then there's a motor part, in other words, the voluntary movements, sensations. So it depends on what part of the cerebral cortex experiences the loss as to what kind of symptoms you're going to see in dementia. Okay, now there's a neuron. Probably recognize that, right? A neuron, a long, skinny cell that is responsible for all of what happens within the central nervous system and the peripheral nervous system, the brain. Okay. Now, this is a picture I got from one of the websites on Alzheimer's and dementia, Neuron Forest, they call it, Neuron Forest. And it shows you how, those are individual neurons, but they are interconnected. And the way we form memories and learning is how those neurons connect with each other. So you can just get a picture of how these neurons are connecting to each other. Now, one of the most important things to remember about the brain is that it has a very extensive blood supply. So this is an X-ray showing you some of the blood vessels to the brain. And it's interesting to remember that the brain is only about 3 pounds. It only weighs about 3 pounds, but it uses approximately 20% of all the glucose, sugar we take in, and about 20% of the oxygen. So if you're talking about a person who weighs 150 pounds, the brain would only be 2% of their body weight, but yet the brain is using 20% of the glucose and oxygen, so that's a really disproportionate amount of nutrients for an organ as small as it is. And if you have a problem with the circulation and you cannot deliver the oxygen and the glucose, then it's going to affect the neurons. It could even kill the neurons if the blood supply is cut off. So if you look back at this picture, then you can see that extensive, and that's only part, that's only the part that they can die and they can actually visualize, but the very extensive blood supply to the brain. So the brain has a huge demand for oxygen and nutrients and a huge demand for the blood supply, continued blood supply. Okay, this is what happens to the brain normally. Normal aging, not dementia, not Alzheimer's, just normal. You have a reduction in the size of your brain. It's pretty scary to think about. Reduction in the size of your brain. You lose neurons for various reasons. Reduction in the number of neurons, which would reduce the size of the brain. And there's a decrease in the blood flow to the brain. Not as much blood reaches the brain, but that can depend upon the person's state of health. So if a person that smokes, that has atherosclerosis, and the blood vessels are getting smaller and not enough blood is reaching the brain, then that person's brain is going to age faster. So one of the best ways to ensure that you have good blood flow to your brain is don't smoke, don't eat a lot of fatty foods, exercise, take care of yourself. You don't want to lose part of any part of your brain. Changes in the organization of the brain, certain connections are lost. A lot of the connections are lost, and that's what affects the memory. It happens to everybody, of course. This is normal aging. The intracellular changes are, in other words, changes that happen within the cells themselves. You get these tangles and plaques that happen in normal brains, but in dementia, that number 5 is just off the charts in terms of the number. So it's normal to have these tangles and plaques, but it's not normal to have huge numbers of neurons destroyed by the tangles and the plaques. And then the functional changes, these were just the anatomical changes, but these are the functional changes, things that actually happen and as you age, your neural processing decreases. It's harder to learn materials. It's hard to learn. I tried to take piano lessons when I was 40. If I was 10, it would be different, right? But when you're 40 and you're trying to learn a new skill, especially a skill that requires a lot of brain power and a lot of muscle coordination power, it was very, very difficult. So it is difficult to learn new skills. not difficult to retain the skills if you learn them early. So that, and they know they're critical periods of learning things like music. So anyway, it wasn't 40 years old. Memory consolidation becomes more difficult. In other words, taking the recent events and putting them into memory and being able to recall becomes more difficult. Anybody over 40, over 50 knows this, right? You have these, I call them in class, I call them brain farts. I have them all the time. I'm talking, all of a sudden I get to a word, that's a brain fart. Happens all the time. It's not, I'm not demented or anything like that. It just is a normal process of aging. And then motor control and precision declines. It's harder to have control over especially very, very fine movements of your hands. And your precision, in other words, how precise your movements are, especially the small motor, becomes more difficult, and your senses decline. You have to wear reading glasses. You have to have the TV turned up even higher. You have to use more seasoning on your food, right? Because your senses begin to decline. So everybody over 45, 50, yeah, know that. And if you think it's not going to happen to you, wait, it will, trust me. But again, the vascular, the blood flow to the brain, keeping it active, keeping your blood flow at a good level is very important. Now that's what I was just talking about. Here is normal things, normal processes of aging. But here is dementia, and this goes beyond, this kind of off the chart, goes beyond the normal aging. And the definition would be the loss of mental functions, such as thinking and remembering, reasoning, that is severe enough to interfere with a person's daily functioning. So, you forget things, you can't remember your third grade teacher's name or something, but that doesn't impact your ability to take care of yourself, drive a car, and so forth. But so it's a loss of mental function. There is a reduction in most areas of intellectual functioning, such as language usage, numbers, orientation, knowing where you are, judgment, being able to make judgments about how to spend money and things like that, reasoning ability for abstract reasoning, problem solving, and the ability to think abstractly. And this a lot has to do with numbers. And these losses impair a person's ability to function independently. But remember, it depends on what area of the brain is affected. So some people might have problems with remembering names of common objects, and some people might have problems in other areas. So again, it depends on the brain area that is damaged. Okay. And the reason why this is so personal to me, so important to me, my dad was diagnosed with Alzheimer's about 1.5 years ago. But he will be 90 Christmas Day. So he went a good long part of his life without having Alzheimer's. So that's the good news. People who have dementia very often don't understand numbers or what even the numbers are for. So they can't balance their checkbook. And unfortunately, there are some not so honest people that could take advantage of older people, right? If they can't make good judgment. So, okay. Dementia is one of the most common causes of institutionalization, morbidity, and mortality among the elderly. So if you work in a nursing home or do work in a nursing home, you're going to find that a huge number of the patients are demented. They have dementia for one reason or another. But another thing to remember is dementia is not a disease unto itself. It is a group of symptoms that might accompany certain other diseases, like Alzheimer's, like Parkinson's, like head trauma, things like that. But having dementia is like saying you have a fever or you have inflammation. I mean, you can have a fever for lots of reasons or inflammation for lots of reasons, but dementia you can also have for lots of reasons. So it's really more of a symptom of something else going on, like having a fever. Okay, risk factors for dementia. Obviously, the largest risk factor is age. 5 to 8% of all people over 65 have some dementia for some reason. That risk doubles every 5 years. So at age 70, it would be 10 to 16%. 30 to 50% of people over 85 have dementia for one reason or another, not necessarily Alzheimer's. But this is interesting, but 50% of people over 100 do not have dementia. It's like if you live long enough, If you live long enough, you're going to be one of those people that, one of the, 50 to 70% that didn't develop dementia, because dementia, Alzheimer's in particular, can kill you. So if you have lived to that 100 mark, the chances are very good you don't have dementia. So that's good news. Family history is a risk factor. Smoking is a risk factor. Again, that has to do with the blood supply to the brain. Alcohol and drug abuse. Alcohol and drug abuse can destroy neurons. So that can lead to dementia as well. Atherosclerosis, hardening of the arteries, that is caused by mainly by the foods you eat and the plaques that can settle in those vessels. High levels of cholesterol, and this one is related to this one. So these two are related. And Down syndrome. Down syndrome is a hereditary condition where people have 3 copies of a chromosome, and just about everybody that has Down syndrome gets Alzheimer's disease. So they think that there's a mutation on chromosome 21. Now, types of dementia, different types of dementia. The first type is cortical dementia. And cortical dementia affects the cerebral cortex. That's this highly folded area of the brain that if you spread it out, it'd be the size of a pillowcase. Subcortical would be underneath. So if I take my brain apart here, then the subcortical dementia would be down in here, underneath the cortex, in other words. And then multi-infarct dementia would be both cortical and subcortical brain areas. Now, if you look at this multi-infarct, what that usually refers to is people who have had strokes. Infarct always refers to a restriction or a decrease in the blood flow. So you've heard of a myocardial infarct, right? That's a heart attack. A brain infarct, of course, is like a stroke. So it can affect both cortical and subcortical, and then of course the dementia would be even much more pronounced. Now, dementia can be reversible or treatable, but that can be caused by these: chronic drug use. Well, that's easy to remedy, right? Stop using the drugs. Chronic alcohol abuse, same thing. Stop using the alcohol. Easier said than done, right? Tumors that are operable, tumors that can be removed, are also, after the tumor is removed and the person returns to, some normalcy. Subdural hematoma is a brain injury, an injury due to it's a bruising, really, or a collection of blood underneath one of the meninges, and that's due to a head injury. Metabolic problems such as vitamin B12 deficiency. Hypothyroidism. And that would be the conditions of, there's a lot of symptoms for hypothyroidism, but a person who takes Synthroid, you've heard of this, Synthroid would be a person who is has hypothyroidism. Hypoglycemia, low blood sugar, that kind of makes sense, right? Because if you have low blood sugar, then that glucose is not getting to your brain, to the metabolism of the brain cells, and that would obviously affect your brain functioning. And then poisoning by lead or other heavy metals. So these are reversible causes of dementia, and that's good news, that they can be reversed. Now, it doesn't mean the person will return to completely normal, but it certainly would reduce the amount of problems. And then non-treatable causes of dementia: Alzheimer's disease, unfortunately not treatable. Pick's disease is a disease very often confused with Alzheimer's. Lewy body disease is an interesting one. Lewy body disease very often affects the back lobe of the brain, and it results in hallucinations. A friend of mine works at a nursing home. She says she had a patient with Lewy body disease that would scream, saying that there were insects crawling up the walls, and there were mice and animals in her room. Just really weird symptoms. And obviously she was demented. Vascular dementia, now that is all, again, caused by, vascular means vessel. So this is the kind of dementia caused by lack of blood flow. Parkinson's disease, another risk factor, non-treatable cause. AIDS. AIDS can, of course, it destroys the cells in the immune system, but it can also, virus, destroy the neurons, and depending on how many neurons and where, it can result in dementia. So AIDS influenced dementia. And a single traumatic brain injury, a single traumatic, a really good knock on the head, could also cause non-treatable, because again, once the neurons in that area die, they're not coming back. And then there's some others that are kind of rare. Huntington's disease, very rare. Hydroencephaly, water on the brain. Developmental problems. Now this would be dementia among children that had developmental problems, were born with these problems, and then the dementia, of course, lasts throughout the life. Infections, meningitis, brain tumors that are inoperable. And then Boxer syndrome is an interesting one. Boxer syndrome is related to brain injury. Because boxing, you know, the person's head is being moved around, and there's a lot of problems with boxing. In fact, the American Medical Association has come out against boxing. Not good. Get in a ring and have somebody beat you up. Good idea. Okay, so that's the non-treatable causes of dementia. Okay, here's signs and symptoms of dementia. You probably already know this. Memory loss of information over recent events. Disorientation. People don't know where they are. Communication problems, of people forget simple words. And that's, I'll show you this later, one of the tests for Alzheimer's or dementia is to name a common object. Name a coffee mug or a water bottle, and people have a hard time with those. Or they substitute irrelevant words, and you can't understand them. Abstract thinking, simple calculation, balancing checkbook, or they forget what numbers are for. Poor or reduced judgment, especially during emergencies, especially during where you really need that quick response, and they just don't have it. Mood or behavioral changes for no apparent reason. Problems with performance of familiar tasks such as making meals, using the telephone, or dressing. They don't know what the telephone's for. They don't know what, you know, they don't put the clothes on the right way, or don't put them on at all. Misplacing articles or placing articles in inappropriate places. Taking your wristwatch and putting it in the sugar bowl. Taking your checkbook and putting it in the freezer. You know, those are, you know, those make sense to us, but it's a result of dementia. Loss of initiative. Depression, watching TV, sleeping a lot, passive behavior, and dramatic changes in personality. Where a person who is very sweet person becomes really combative, or a person who is not so sweet becomes very sweet. I read an article recently about a lady that her mother developed Alzheimer's, and she said her mother was a very strict, strident, always yelling woman, and when she got Alzheimer's, she was the sweetest woman. So, anyway, and didn't know it before. She don't know it. Diagnosing dementia. So this is not Alzheimer's necessarily, but diagnosing dementia, taking a medical history, looking and see if they have hypothyroidism or hypoglycemia. Basic medical tests like liver function and glucose tolerance. A neurological exam like reflexes and balance, because if you have a problem with balance and coordination, the problem might be in the cerebellum and not the cerebrum. Mini mental state exam, or MMSE, is commonly used to assess mental functions. Questions could include: state the current day of the week, year, and the season. And most people should be able to do that. Remember and recall the names of 3 common objects. There's 3 household common objects. Count backwards from 100 by 7. That seems kind of challenging anyway, doesn't it? Unless you're a number person. Spell the word backwards. Name several familiar objects pointed to by the doctor, and tell a common proverb or saying. The early bird gets the worm, the tortoise and the hare, you know, those kind of common type of sayings. So that's one way of diagnosing dementia. But it usually starts out by taking the medical history and looking at these physiological things that would impact your mental functioning. Now, diagnosing dementia can also mean brain scanning, CT scans, MRIs, PETs. EEG, electroencephalogram, and a psychiatric evaluation, obviously done by a psychiatrist. And that would check for depression and other psychiatric disorders, because schizophrenia and some other psychiatric disorders sometimes can mimic dementia. Now, so now we're going to talk about Alzheimer's disease, which is a reason for dementia. It was named after a man named Alois Alzheimer. He was a German physician who first described it in a female patient in 1906. This female patient was a fairly young woman in her 40s. And you have to remember, in 1906, most people didn't live too much past the age of 50 or 60. So it wasn't a real issue. And before 1906, just think about what most people died of. They died of pneumonia, they died of measles, they died of smallpox, and most people didn't live to old age. So it is a fairly recent disease, or at least described disease. Alzheimer's disease accounts for 60% of all dementias. 60%, so that's pretty significant. As many as 5.2 million people in the United States are living with Alzheimer's disease. And this one's scary. 10 million baby boomers will develop Alzheimer's disease during their lifetime. And baby boomers are described as people born between, what, 1945, 1960, something like that. So a lot of people. And what that means is that that's going to be a huge drain, a huge demand on hospitals. So nurses, you guys are going to be dealing with a lot of us baby boomers. I hope I'm not one of them, but anyway. Every 71 seconds, somebody develops Alzheimer's disease. It's the 6th leading cause of death. A lot of people don't think you can die of Alzheimer's, but you can. Because as neurons are destroyed, then it's the neurons in the deeper part of the brain that would actually destroy your involuntary functions. And this is really kind of scary. Direct and indirect costs of Alzheimer's disease amount to more than $148 billion annually. You think about Medicaid, Medicare, and businesses. So it's a very costly, very scary disease. 3 types of Alzheimer's. 3 types. Early onset. Not very common, less than 10% of cases. People 65 and up, younger. So the woman that Dr. Alzheimer first described was early onset. And as I mentioned before, many victims have Down syndrome. Down syndrome, trisomy 21, and it's almost a given. If you have Down syndrome and you live to a certain age, you'll get Alzheimer's. And a genetic defect on chromosome 14. So that's early onset. Now, late onset accounts for 90% of Alzheimer's cases. So my dad wasn't diagnosed until he was 88 years old. So that's obviously late onset. It's also called sporadic Alzheimer's disease, and that's in older people, 65 years and older. And again, scary, and I think I already mentioned this, 1 in 2 chance of developing this type of Alzheimer's when you're 85 years or older. But if you live to be 100, then okay. And then the 3rd type is called familial Alzheimer's, which means it's inherited. Familial refers to, it runs in the family. And these are probably the scariest ones because, you know, your dad has, your mom has it, and you're thinking, no, you know, it could be me. Anyway, but that accounts actually for less than 1% of all cases. And many times this kind of Alzheimer's develops quite early, in the 40s and the 50s. So it's not something that, you know, if you get to be, you know, in 60, you probably dodge that bullet. And it is inherited on different chromosomes. There's 23 pairs of chromosomes. And out of the 23, look, there's 4 that are being researched in terms of having the gene for Alzheimer's. Okay, diagnosis of Alzheimer's. Alzheimer's is only ultimately diagnosed at autopsy, at death. They don't do autopsies on everybody, but they can't really tell if you have Alzheimer's for sure until that you have a autopsy. Person's brain is autopsy. The autopsy reveals neurofibrillary tangles. In other words, these tangles where the neurons become trapped and they tangle, and once they tangle, they're useless. They can't function. Or you also have twisted masses which are twisted masses of fibers inside the neurons. So it basically kills the neurons. Autopsy also reveals senile plaques, which are parts of neurons that are surrounded by these certain proteins called beta amyloid proteins. But here's the weird part about it. It is not clear if these are the cause or the effect of Alzheimer's. How do you know? It could be the Alzheimer's could have caused it, it could have affected it, who knows? So it is not clear if they are the cause or effect. So that's another, a real mystery. Risk factors. Ultimate causes or the cause or causes are still unknown. Who really knows? except the familial, and even then you could have a family member with it and never get it. Several risk factors appear to increase a person's likelihood of developing the disease. And the risk factors, just like in dementia, include age. That's the biggest one. Because again, if you're over 85, you have a good chance of developing it. Family history of Alzheimer's disease. It increases your risk. Doesn't guarantee it, of course. Down syndrome, but that pretty much does guarantee it, unfortunately. Parkinson's disease, also a risk factor. Hypothyroidism, a low-functioning thyroid gland. Head trauma. Head trauma is always a risk factor for Alzheimer's. And I hope that in the future we won't see a lot of these boxers and these fighters, developing this disease, but chances are pretty good they will. Now, environmental factors. Several environmental factors have been suspected of contributing to Alzheimer's, but studies have not borne out these links. Aluminum, for a long time they thought that, here's the ones that they thought were the environmental factors: pollutants, water pollutants, and so forth, air pollutants, aluminum cans and cookware, metal dental fillings. For a long time I thought that was, we had dental fillings, and most of us do, but those have not been borne out either. To date, none of these have been shown to cause or increase the likelihood of developing Alzheimer's disease. So, but it would be nice if, actually it would be really convenient if they could find a culprit. They say, oh, yep, it's aluminum. And that way we could eliminate that from our culture, from our products, but it isn't. Genes in Alzheimer's. So some Alzheimer's disease is inherited. Mutations in the gene for the amyloid precursor protein. Now, remember we said that one of the symptoms or at autopsy is to have these beta amyloid protein deposits. So they know that if you have a certain gene for that amyloid protein, it can be linked to some early onset forms of Alzheimer's. We all have that a gene for amyloid protein, but if it's a defective gene, it might actually cause it. Mutations in the gene for protein presenilin, which is another protein, also implicated. And again, Alzheimer's disease affects almost everybody with Down syndrome. And that's a condition caused by receiving an extra chromosome 21. So research is ongoing into chromosome 21s. They feel like, gee, if you have 3 copies and you just about always get Alzheimer's, then chances are pretty good that there's something on chromosome 21. Here's another information about genes in Alzheimer's. Potentially, the most important genetic link was discovered in the early 90s. So this research has been going on for many, many years and will continue, of course. A gene called APOE codes for a protein involved in transporting fats into neurons. So you nurses know the lipid transport. And it occurs in 3 forms, and each person inherits one from each parent, like most genes. People with a copy of this gene are 3 times more likely to develop Alzheimer's, and those with 2 copies of this gene are 4 times more likely to do so. So that kind of tells you that if this gene is implicated, then perhaps a genetic test can be figured out, right? And you can take a genetic test, and if you have this gene, well, then what do? Can't really do anything to stop it, right? Don't tell your insurance company. Okay. Anyway, but not everybody, and this is interesting, but not everybody with that gene develops Alzheimer's disease. And people without the gene still develop Alzheimer's. So, again, research is ongoing. Why it increases the chance of developing Alzheimer's disease is not known at this time. I don't know. Okay. Reducing your risk. This is something that we all are interested in. The use of non-steroidal anti-inflammatory drugs, which include acetaminophen, ibuprofen, and aspirin. In other words, not prednisone, not cortisone, but those anti-inflammatory drugs. You don't have to have a prescription. They're non-steroidal. They reduce inflammation. And it is believed that inflammation is a possible trigger in the formation of plaques and tangles, those things that are revealed during autopsy that apparently kill the neurons. Increasing blood flow in the brain, which is a beneficial effect of estrogen, appears to reduce the risk. Many studies are aimed at giving older people estrogen to ward off Alzheimer's. Here's the problem. Estrogen has been linked to many other conditions, including breast cancer. So anyway, that is reducing. So being a woman that has plenty of estrogen being produced by her ovaries during her reproductive years, so before the age of 50, she's probably at a reduced chance of getting it. And highly reactive molecular fragments called free radicals, most of us have heard of free radicals, right? You've heard of these. They believe that those free radicals they know that they damage cells, including neurons. So if you take antioxidants such as vitamin E, ginkgo biloba, certain B vitamins, that is showing promise as being able to kind of reduce your risk, maybe not prevent it altogether, but maybe delay Alzheimer's disease. So you can reduce your risk, and again, research is ongoing. Alzheimer's vaccine. This is very exciting. The vaccine has been tested in mice. They've actually taken mice and genetically altered the mice so they are predisposed to having Alzheimer's. And they have found that this vaccine reduced the tangles and the plaques in the brain and improved maze running ability. Put mice in a little maze and let it run. That means that their brain is working pretty well. And so, but a preliminary trial was done on humans. So it actually helped the mice, but not all research done on test animals proves out in humans, of course. But a preliminary trial of a human vaccine was stopped because the people developed, and some of them, not all, but some of them developed immune encephalitis. So not good. So they pulled that trial. And again, studies are ongoing. So we can all hope that by the time we get closer and closer to the age in which we might have these symptoms, Alzheimer's symptoms, that they'll figure out what the problem, what actually causes it. But you have to figure out what causes it before you can actually treat it. The drugs that you see for treating Alzheimer's never reverse it. You can't reverse it. But some of the drugs for treating Alzheimer's, Aricept is one of them, has been shown to kind of slow down the progress, but the drugs only appear to be effective for a year or two, and then they lose their effectiveness and the person continues to go downhill. So again, this is very exciting, the Alzheimer's vaccine.